Well, hi, everybody. My name is Garrett Schmidt, and I am the CEO and managing editor of VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Lightbeam Health Solutions with special guest El Centro de Corazón, which we will introduce here momentarily, but very excited to hear from our speakers today. We've got a lot of things to cover, but I wanted to run through a couple items here with you, just some housekeeping things. This is a traditional webinar format, so everyone has joined in listen only mode, so you don't need to worry about turning off your camera or your microphone or anything. We can't see you or hear you. However, we are going to have some time for Q&A towards the end, so we would like to hear from you. So if you have a question for any of our speakers or just in general at any time during the presentation, you can ask that using your control module. There's a place specifically for questions. And we're going to get to as many as we can. If for some reason we're not able to get to yours or we run out of time, don't worry, someone will reach out via email to make sure that we answer your question later on. But we're going to get to as many as we can. Also, we're going to have a polling question here at some point, so you can play along at home. And those are anonymous, and it's just more for you to see kind of where you stack among your colleagues. So we'll explain that when it happens. Finally, the session today is being recorded. So what is going to happen is when we're done, maybe about an hour or so after we conclude, you will receive an email, and that email will have a link to the recording as well as to the slides from today's presentation that you can download. And with that recording, that way you can review it at your own leisure, share it, send it to colleagues and friends. Hope that you do that. So yeah, please feel free. So without further ado, wanted to briefly introduce our speakers today. With us, we have Miss Laura Thomas, who's an RN, MSN, and she's the Director of Clinical Quality at El Centro de Corazon. And then we have Griselda Noyola, and she's the Quality Assurance Specialist there. And then we have Andy Day, and he is the CMO at Lightbeam Health Solutions. And so I believe, Laura, are you going to get us kicked off, or is that you, Andy?
Yeah, I will. I will.
All right. Well, welcome, guys.
Awesome. Thank you, Garrett. It is indeed a privilege and a pleasure. And welcome to this webinar. I am really honored to be joined by our speakers from our very esteemed customer, Centro de Corazon. So with me on this webinar are Laura Thomas, who's the Director of Clinical Quality at El Centro de Corazon. She's a clinician by training and received her undergraduate and master's degrees in nursing from the University of Texas at Austin, and a Woman in Health Nurse Practitioner Certificate from Columbia University. She has worked in nonprofit healthcare for over 15 years and came to El Centro de Corazon in January of 2024. Also with us is Griselda Noyola, who has been a medical assistant at El Centro de Corazon for 12 years. In February 2024, she commenced on a new role as the Quality Assurance Specialist and has been one of the primary care coordinators of El Centro's Care Signal program, which we'll talk about at length, and has served as a point of contact for enrolled patients. And finally, I'm Andy Day. I'm the Chief Marketing Officer at Lightbeam Health Solutions and have just joined the organization recently. Very excited to be here. I lead the global marketing efforts for our population health management and value-based care solutions. Very passionate, and I've been in the healthcare industry for almost 20 years with senior product management, marketing, and chief marketing officer and general management experience at SAP, G Healthcare, Tableau, Alteryx, and Medi Analytics. So let's get started. Let's go on to the next slide. Talk about what our key objectives are for this webinar. We'll discuss how El Centro de Corazon integrated remote patient monitoring and care management strategies and programs to enhance proactive patient management, which you'll hear about at length. We'll evaluate El Centro de Corazon's measurable outcomes from this program, including substantial reductions in blood pressure from the hypertension program and the increased communication with patients and impact thereof. We'll examine some of their best practices in terms of health equity for implementing technology to reduce health disparities in underserved communities. that many of us, including I, am passionate about. And we'll explore how El Centro de Corazon's success with hypertension management can be extended to and replicated in other communities and settings. So a little bit of an overview. Next slide, please. So what are some of, next slide, what are some of the industry-wide challenges facing federally qualified health centers? So health disparities are increasingly exacerbated by barriers to access and technology. Clearly, as we all know, we are in an era where we're seeing a big shift towards value-based care, where the focus is on the quality of the care delivered and not just the quantity of services. While this is overarching, strategic, a positive change, it also comes with some serious challenges in its wake, especially since financial and staffing resources are not keeping up with increasing demand and in turn are presenting barriers to access in both urban and rural areas. And finally, integrating technologies, especially newer technologies, to empower healthcare personnel such as clinicians, nurses, care managers poses challenges in successfully adopting new and innovative technologies like artificial intelligence at scale. So these challenges, as you can imagine, collectively impact a federally qualified health center's ability to provide comprehensive, high quality care to the vulnerable patient populations they serve, really driving the need for innovative solutions and the increased support to overcome these obstacles. So with this, I'd like to transition this over to Laura to continue the narrative.
All right, thank you, Andy, and hello, everybody. Thanks for having me. It's good to be here with you all today. I'm Laura Thomas. I'm a women's health nurse practitioner, and I'm going to be talking to you a little bit about our experience with remote blood pressure monitoring. So I wanted to start by sort of why one of the reasons of why this is important in healthcare. Measures, the way we perform on measures really, really does impact our reimbursement. As a federally qualified health center, we do report our information to HRSA, right? Patient demographics, clinical outcomes, how we do on certain quality measures. Obviously, blood pressure is one of those. There's many others: cancer screening, depression remission, chronic disease management, diabetes control, et cetera. Also, our productivity, how our staff is doing, and our financial performance. And all of this gets reported in, and we can compare ourselves to how other counterparts are doing across the state and across the country. And how we perform in these does impact, our reimbursement. As Andy was saying, value-based care is really, really taking more and more of a footage every day. It's becoming more present in healthcare. And so from a provider, I want to make sure my patients are healthy. I want to make sure our communities are healthy. And part of doing that is making sure that as an organization, we're healthy and we can be here and continue to provide these services for a very, very long time. So the better we do, perhaps, the more attractive we look on grant applications for reimbursements, and also just for value-based or quality incentives that may be out there. In fact, there is a federally qualified health centers with the top quartile in UDS performance actually secure 20% higher reimbursement rates through combined federal state value-based payments compared with lower performing centers. So I do just want to make the business case that there's a reason to care about these quality measures. I think there's a whole lot of reasons, but there's certainly a business case reason in additional to wanting to make sure that our patients have the very best outcomes and reduce risk as much as they can for themselves. All right. So a little bit about us at El Centro de Corazón. So we're located here in Houston, Texas, one of the biggest cities in the United States, also one of the most diverse cities in the United States. A little bit about who we served in 2024. So we served a total of 12,820 patients. Just about 95.4% of our patients are Hispanic, Latino, or of Spanish origin, and just under 80% speak a language other than English. That is predominantly Spanish, although we do have other languages. We have some patients that speak some of the Mayan dialects, other languages, but predominantly Spanish. and 54% of our patients are uninsured. We have 3 health centers. We're located very centrally in Houston. It's a very urban area. We're just east of downtown. We have our Eastwood Center, our Magnolia Health Center, and our Dunn Health Center. And in their centers, we provide primary care, pediatric care, OB-GYN, behavioral health, and dental services. All right, Andy, would you like to take this slide, the goals of the partnership? Or I'm happy to as well. Okay.
Oh, is Andy frozen up? Let's see, he'll come back on. There he is.
There we go.
Sorry about that. Something technology issues. So the primary objective with Lightbeam's deviceless remote patient monitoring solution is to transform care management from manual and outbound outreach to really an automated virtual outreach with inbound insights for 30 plus chronic and behavioral health condition specific programs. So really there are 3 primary goals with this partnership, which is to increase the number of patients with controlled hypertension. And to do that, obviously, it demanded higher engagement to improve care management for patients through better communication and higher engagement rates, and finally, improve communication with the patients enrolled. So let's look at what is exactly deviceless RPM. If you can go to the next slide, Laura. What is deviceless remote patient monitoring versus conventional, or what is more, device-based remote patient monitoring? So the fundamental difference is that standard or conventional remote patient monitoring involves connecting remote, Bluetooth-enabled devices, which are, high-tech but require, a bit of technical knowledge savviness, if you will, from the patients to be able to use them, which also imposes additional cost burdens just because of the additional technology involved. So deviceless remote patient monitoring, such as the one from Lightbeam, is really interesting because it just uses your cell phone or your landline to use text messages and phone calls to connect you and send you clinically relevant questions about your chronic condition. So for a patient with hypertension, it'll ask about your blood pressure, or for a patient with depression, it'll talk about your PHQ depression screen. For patients with social determinants of health, it'll ask them questions about their food access. For patients with diabetes, it'll ask them about their sugar levels or A1C. So in many ways, it's a way of collecting a lot of valuable patient data in a non-intrusive, in a very conventional way, using technologies they are extremely familiar with and use on an everyday basis, so which is easier to access for them. And this also enables you to fundamentally scale this to much larger patient populations and also improve your capacity in the process. In addition, this technology we're talking about is well tested and published in 13 peer-reviewed publications, so it is truly evidence-based. Let's go to the next slide and we look at how this is actually deployed. Laura, if you can go to the next slide. So as you can see, it clearly marks out the population of patients who have been enrolled and specific conditions. And then on the cell phone images on the right, you can see how the care manager, the case managers engage with them by way of simple messages, asking them what their blood pressure, systolic, diastolic levels are, and then what their condition is. And if patients are feeling well, they can easily respond with minimum of efforts needed. On the right hand side, there was actually a violation of those thresholds, which triggered that message from the case manager asking them whether they've taken all of their blood pressure medications on that day. And if they have, then the patient is doing well, and also provides standard messaging for them to be able to contact someone should they need help. So as you can see, this is very simple two-way communication using technologies that are relevant, accessible, not very expensive, which is where the efficacy of the program lies. So if there is a violation, or if there is if there are alert thresholds violated, it automatically triggers alerts to the care or case managers, which enables them to be very proactive rather than reactive, reach out to these patients in question and prevent the patient's condition from worsening into an acute situation. So with that, let's go on to the polling question on the next slide. Garrett, if you can bring that up.
All right, so you will see a question emerge on your screen here. And the question is this: where are you in your remote patient monitoring journey? Now, this is anonymous, so feel free to participate here, and we're going to show the results so you can kind of see where you stack among your colleagues. And is it we have not implemented, we are planning to implement, we have implemented, but for less than 100. We've implemented for between 101 to 500 or for over 500. So wherever you stack in that, and this will again give you kind of a good gauge of what your colleagues are facing and sort of how much has been implemented across the board. Okay, I think most of the results have come in now, so I'm going to close it down in maybe another 10 seconds here, and then I will show the results. Okay, I'm closing it down in 5, 4, 3, 2, and 1. All right. Andy, are you able to see the results on your
Yes,
end? And if you wouldn't mind
absolutely.
reading out the percentages for those who might be calling in, that would be great.
Absolutely. So really interesting, 42% have not implemented, while 21% are planning to implement a remote patient monitoring program. 16% have implemented for less than a population 100. 11% have implemented for 101 to 500 patients, and only 1% have implemented, sorry, 11% have implemented for over 500. So a pretty interesting distribution, and interesting to see that the majority have not yet implemented. So we hope your learnings from this webinar and from the actual real world experience at El Centro del Corazón will be insightful and encourage you to potentially contemplate adopting a remote patient monitoring deviceless remote patient monitoring program if that is aligned with your strategy. With that, I'd like to transition this back again to Laura.
Thank you. Okay, so we're going to talk a little bit about how we implemented the remote patient blood pressure monitoring here at El Centro de Corazón. I think there's a lot of different ways that you can implement this, and we'll try to touch on things we did that really worked, things we did that we maybe should have done differently, to try to help folks that are in the planning stages. But I think you can also just imagine what it would look like. I know at your center, your organization and your patients best. But essentially, what we wanted to do was, there's different ways you can do it. Kirsten can enroll folks for you, but what we wanted to try was enrolling our own patients, right? So what we did was create a very kind of simple work plan just to give to our staff. Our staff are really the key. As we all know, our frontline staff are the key to making almost anything successful. And so we wanted to be sure to really educate them, have them fully understand this program, what it is, how it's supposed to work, how we want it to work, how it will serve patients, and also how it helps them in their day-to-day role, right? And so we came up with a workflow that we shared with them. And essentially, it all kind of started with the intake medical assistant, the person working up the patient, understanding what the program is and if the patient could be eligible for it, right? So we gave them specific criteria. They can't just have high blood pressure that day. They have to have a diagnosis of hypertension. We gave them the names and also the ICD-10 codes saying, they need to have this on their chart. We're really targeting this program to patients that are diagnosed with hypertension. So if you see this on a chart, this is a good flag that this person may be a good candidate to enroll in remote patient blood pressuring program here at El Centro. But that's not all, right? We need to make sure that they're a good fit for the program. Our patients deal with different sort of barriers to healthcare, right? And transportation, food insecurity, different barriers to proper health. And so one of those is access to a phone. So we wanted to make sure that anyone we were going to enroll had access to a phone, which is not always a given, and that they're able either to answer text messages, which the vast majority of our patients have a phone and are able to do that, but not everybody. But if they couldn't couldn't answer text messages, could they also dial in readings on a phone, right? So they had to be able to meet that criteria as well. And then the last criteria is that they were able to properly place and work a blood pressure machine, which again, the vast majority of our patients can, but not everybody. So we let our medical assistants know if they meet those simple three criteria, then they could be a candidate for care signal. And medical assistants really hold so much power when it comes to sort of, guiding how a visit goes. So what we ask them to do is flag for the provider, hey, we have this patient, Mr. and Mrs. So-and-so, they have hypertension. They may be a good candidate for care signal. I wanted to let you know that before you go in the room, right? And just that simple conversation kind of tees it up for the provider to have in their mind as they go in and are talking this to the patient to see if this is something that they want to offer. So the provider's role is to go into the room, do their usual thing, and as they're talking about blood pressure control and management, if they think the patient would be a good candidate, then offering them enrollment in the program. And we really wanted it to be at provider discretion. We didn't want to like totally algorithm out what they were and were not allowed to do, right? We wanted them to use their professional opinion to determine if this patient would be a good candidate. They often would say like patients newly diagnosed with hypertension were good candidates because these patients are not in the practice, they're not in the habit of taking their blood pressure. And so setting them up for success early by giving them specific criteria and tools to do that tended to work really well. So new patients tended to be ones that they were interested in, or patients that just had a really hard time controlling it. Maybe they're here every 3 months or every 6 months, and they're taking their meds as best they can, and the blood pressure is just still not controlled. Well, what's going on, and can we help them with this remote blood pressure monitoring program? And so it wasn't just limited to that, but those were some of the ones that tended to be really good candidates for this program. So if the provider determined they were eligible, then we would have the discharging medical assistant, the person sort of, wrapping up everything for the patient, just give a brief explanation and a brief tutorial. And we are talking brief. We know in healthcare, there are a lot of things that need to happen during that visit. We're not trying to add on, 20 minutes, 10 minutes, even 5 minutes. It's a very brief conversation. So they would say like, you're eligible for this program. It's going to be a 6-month enrollment. And what we expect from you is just to respond when you get a text or respond when you get a call. It's going to come right here to your cell phone. And all you got to do is just follow the prompts, right? And then they would give them a booklet with how to take a blood pressure, right? Because these are things that it's actually really important, as we know as providers, like how you take your blood pressure, right? Like making sure that they were taking it correctly so that they're getting accurate measurements and they understand how they need to take their blood pressure. We were very fortunate to partner with the American Heart Association, and we had some blood pressure machines that we were able to give to patients. It's not a must. It's excellent if you can find resources to do that, because that's really empowering to go home with that machine ready to use. But obviously blood pressure machines are available for not, they're not terribly expensive out in the marketplace. And then also if that really is a barrier, most grocery stores or pharmacies have a blood pressure machine there. And so, when you go to the grocery store, you can go ahead and, take your blood pressure and respond to that text at that time. So we would give them the machine and the information, and then we actually really wanted to set them up for success, like real time. Let's do this when you get home, right? And so we would actually put in the batteries to the machine, power it up, and go ahead and take their blood pressure, just showing how we take it, the proper placement, where it goes on the arm. If you're wearing a sweatshirt, take that off first, roll it up, those kinds of things, where you should place your arm. And then we would have the patient just repeat it back really quickly. Like once we took their blood pressure, then the patient would take their own blood pressure to verify that they were understanding what we were instructing them. And then we would just say, you're going to get a call about enrollment. Just, answer when we call, and we'll talk to you a little bit more, set things up, just some more background information. But we didn't want all of that like logistical stuff to happen in that visit. That patient's there for their visit. This is a piece of their care that they're getting. It needs to be quick and efficient. And it really ended up being quick and efficient. And I think instead of being like an extra burdensome thing to the staff, I think it was actually quite empowering. It's like we're really taking care of this person. We're giving them stuff. We're giving them information, and they're really excited about this. And so I think it ended up sort of positively impacting not just patient experience, but staff experience as well. Let me move on to the next slide here. Griselda, would you like to talk a little bit about sort of our process, and where we started, some other things that we tried, and then where we kind of ended up?
Thank you, Laura. Hi, everybody. I'm Griselda Noyola. So I was a medical assistant here for about 10 years. where we started rolling out, remote patient monitoring while I was still on the floor. Our first phase with CareSignal was through a pilot program that was offered to us through TAC, which is a Texas Association of Community Health Centers. They really came on and said, we have this great program with CareSignal. We can help you all start up and see, where it goes, if it's something that benefits your clinic and your patients. And they really helped us start that. We just handed them over a report of all of our patients who had the qualifying diagnosis, and they did, the initial enrollment outreach and setting up the patients into CareSignal. So they did all of that part for us. And then once they had them fully enrolled, then they would send them to us saying, these are the patients that need a blood pressure machine. So thankfully we had that available, and we were able to bring the patient in either for a follow-up appointment or just like a MA visit to give them the blood pressure machine, show them how to use it, if they had any questions regarding how to answer those touch points on the text message, things like that. And so we got all of those patients in through that. Once we filled up these slots through CareSignal, the next phase, the second phase would have been, we had patients that were dropping out or just not coming back to us. So instead of having CareSignal doing another large outreach, we tried doing our own outreach and enrollment in clinic with the patients that were currently in our clinic and, current patients. So that's whenever we came up with that workflow of having the medical assistants be part of the enrollment, the education, and getting the provider engaged in offering the program as well. And then we also started doing we had patients on here for so long that they were staying in the controlled range. They were doing everything they needed to do, and we just thought, oh, we can, maybe graduate these patients since they've been doing great and getting newer patients into the program. So that's where we're at now with the 6-month program. I'm trying to give the opportunity to different patients and giving them enough time to use the software as well.
Right. And so one thing that I think has been really helpful to our patients is just making sure that the messaging is coming from El Centro. It's such a helpful partnership with Lightbeam to be able to get a lot of this stuff handed to us and not have to worry about the tech behind it, but just having El Centro's name on it coming from us, is really important. Our patients know us and they trust us. And so, I know that this, feels very standard, but it did feel like a very important thing for our patients that anything that came out, anything that they were getting, even if we weren't the ones actually pushing it, was coming from El Centro. So they're much more likely to respond to that. So I just want to flag that that's an important piece of both enrollment and I think ongoing engagement as well. And I want to just kind of set this up and then send it to Griselda to talk a little bit about the nuance. But, we had a desire to change hypertension initiatives as an organization, and doing the remote patient monitoring is a piece of that, right? There's a lot of other things we were trying to do, around diet, exercise, nutrition security, food security, empanelment of patients, lots of different things we've been trying to get blood pressure up, or to get blood pressure control up. And using this technology wasn't the first one that we used. We actually used a different technology first. And I'd like Griselda to talk a little bit about what we used, because we were really excited about it and it was really, really fancy. And then we learned a lot from it. It's one of those lessons learned. So Griselda, if you can talk about the iPhones that we initially started with before we came to this technology.
Right, yeah. So before we were offered the pilot program for CareSignal, we had the first initiative was just through the American Heart Association and Target BP with just like educational resources around diet and exercise that could help reduce hypertension. But it wasn't, it was just like a folder with some information and a blood pressure log, but nothing else to go along with it. So we were handing out the information and giving them what they needed for that piece of it, but we didn't see too too many results come from those resources. And then we received another initiative through OCHIN, which is our electronic medical health record, and they offered us an RPM program that included giving the patients an iPhone that's tailored specifically for health, like their healthcare needs, along with a blood pressure machine that communicates with the iPhone. And then these iHealth devices communicate with MyChart. So our patients had to first have a MyChart account set up, which we find pretty difficult to get as many patients as we would want in MyChart, the patient portal through Epic. So it was first having a MyChart account set up, being able to use and know how to use a iPhone and know how to, Bluetooth and connect to the blood pressure monitor. So when we first got this program, we were really excited. It was super fancy. It was really great. We thought it was amazing and it was going to work great. But once we started offering it to patients and showing them how it worked, a lot of our patients are not very tech savvy. A lot of them don't know how to use Apple or iPhones. They have other types of phones and they have never used an Apple device. So just that part of it was kind of, we're getting a lot of pushback from the patients. Like, I don't know how to do that. I don't know how to set up an Apple account. I don't know how to Bluetooth these devices. So it was very, very difficult for us to get patients enrolled into what seemed like an amazing program. So even though we had all of these devices, we were only able to set up 5 patients, which was, seemed very low. But apparently, once we talked to OCHIN, apparently that was on the high end. A lot of other health centers tried the same program and they couldn't get any patients, or they had 1 or 2. So we still took that as a small win with our 5 patients that learned how to use it, but we weren't reaching enough patients. So then once we got the opportunity with the Care Signal pilot, it was a lot easier because it's a simpler program. We didn't have to they didn't have to set anything else up because they were going to be using their personal phone that they use every day. We only had to show them how to self-monitor. Like Laura said, we would give them the booklets that were provided by the American Heart Association on uh, self-monitoring. That showed them exactly how to sit, how to set up the cuff, and other best practices to get the best blood pressure reading. So all we had to do was go through the booklet, set up the machine for them, show them how to use it on themselves, and then show them how they easily can respond to the text message or enter their blood pressure reading in the phone. So that process was just way more easier to get patients to agree to it and stay on the program as well. Like, they didn't have to worry about, Bluetoothing anything. It was just simpler and it worked way better for our population.
Thanks, Griselda. And as I sort of said at the beginning, like, we all know our organizations, our patients, our communities, and they're all unique and different and great in different ways. And so this one just worked a whole lot better for us. There's a lot of great things out there, but we really found sort of just the ease of, like, this program has a really, not steep learning curve, and it worked great for our patients. And so it's really where we have been able to lean in and make some progress. So just sort of a summary of the workflow again. Care Signal can enroll patients. We chose to do that, and then also enroll some of our own. The patients get a text or a call, and then they can just respond. It's very simple and easy to respond to. It comes from us. And then there's a system in the background that will then track and send alerts for these blood pressures, which we'll talk about more in just a little bit. And then we have on our end the management of that. And one thing I did want to flag on this slide is the management of that really isn't, like, it's not a position. You don't have to hire someone to manage your RPM, right? Especially on the, depending on what scale it is. But for our scale, we absolutely didn't need to hire anyone. This can be something that you work into, like, someone's, downtime is checking these. And also providers don't need to be going into this all the time to check and, like, upload or anything like that, right? It's one of those things that we can go in and we can monitor it when we have some downtime, just like when we call patients back, like return telephone calls or follow up on labs. It's another side thing that folks folks can do. And then we can always, flag it for providers. If like, hey, this person has this history, go in and check it, or, here's the log or whatever. And so, that was one of the things when I was first learning about this program. I was like, well, how do you manage it? And the management of it actually works really well within the normal staffing that you have and with the normal staffing we have had and within our normal flows. So let's talk a bit more about it. So first, I want to flag some utilization. So our data, it's really astounding when you look at it. We've come so far. We've sent over 26,000 automated text messages to patients and 3,342 calls. We have had alerts raised, letting us know that patients are, their blood pressure is rising or they're in a higher zone. We have right now 71 engaged patients. We've enrolled over 237, excuse me. And as Griselda said, some folks will get in and use it a whole lot and then kind of drop off, or some folks will, not engage with it. So, but to have 71 core that continue to engage with it, meaning, twice or 3 times a week, they are responding to these messages and they're letting us know how they're doing. It's been pretty awesome to see that they are that committed to their own health and to monitoring this. And I think their commitment has really shown in the numbers. So 55% of hypertension rising risk patients improved, which is just awesome to see that that's happening for our patients. And then we've also had significant drops in blood pressure when we turn these over time, 21.13 for systolic blood pressure and 6.46 for diastolic drop for their patients that are engaged, and 7.72 score on improved communication. So that's just been awesome to see that our patients that are leaning into this are really using the technology, they're embracing it, and they're having better outcomes. So just, kind of again, we've had a 65.8% activation rate and 38% engaged at 23 months. I didn't know when we first started, how long patients would hold on there. And then some patients, have used it and kind of let it go its natural course. And then others have really just incorporated it as part of their daily health maintenance or their weekly health maintenance or whatever it looks like for them. So it's really exciting to see that we've had that continual engagement. You just, we were new to this. This is not something we've done for years and years and years. So, the question is always there, like, do patients want this? Are they going to use this technology? And I think we got our answers with these numbers. And then as far as outcomes, we had 100% high risk improved, 55% risk rising improved, and 39% of rising risk maintained, and then 87% of low risk maintained, which is really great to see, right? I think when people have knowledge about their blood pressure, it really helps them guide their decisions. Like, oh, I haven't taken my medicine today. Oh, when I ate that, or when I didn't sleep, or when I drank that, or whatever it is, my blood pressure went up. So obviously they're using this information to help guide their own choices and to guide their own, healthcare, which has been, again, reinforced by the numbers, which is really exciting. I'm going to move it into the alerts triggered and let Griselda talk a little bit about that, because she would often be someone that was in the background getting some of these alerts. So if you can explain sort of what that looked like, Griselda, and maybe some of the false alarms we had as well, that would be helpful.
Yeah, so an alert would trigger in care signal whenever the patient's blood pressure is, too high, or it might be on a little bit on the lower end, and also whenever there is like a missing reading, like they only sent the systolic or only sent the diastolic. So these are alerts that come to, whoever is a contact in care signal. So I would often get, the email, open up the patient's dashboard and see whether it was too high, too low, or just missing one of the readings. So we had set up a system with our providers saying, if the blood pressure, is on the higher end, I'll be sending you, a telephone encounter. This is the patient's blood pressure reading today. What kind of guidance would you like for me to give to the patient? Usually it was, have the patient repeat it, first go to the bathroom, sit in a quiet space, things like that, to repeat the blood pressure and see if that helped. It could have been something that they just got home from work and checked their blood pressure too quickly. And then the same with the lower end, have the patient just kind of sit down for a few minutes, relax, and repeat the blood pressure. Other instances, we had a few times where the patient did have some symptoms along with their high reading, so we would send them to the emergency room or ask them to report to the emergency room, but those were not very often. The other false alarms would be if the patient typed in the wrong number, like put in 200 instead of 100. So we would just go into Care Signal and edit that reading for that day. And also the patients were informed that, we would receive an alert, but it wasn't like an emergency communication. So before the patient left the clinic, they were aware that whenever you see, a super high reading, these are the steps that you should follow, to repeat and try to get a better blood pressure reading. We would ask them, just kind of understand those those readings and what level of severity you were in before you submit it. So usually whenever I called the patient, they were like, oh yeah, I already laid down, I checked it again, it's fine. So they had the understanding that it wasn't an emergency communication to the provider.
Thanks for saying that, Griselda, because I think that's a really important piece of it for me as a provider. I'd hate to think someone has, interest a really high reading is like waiting on us to like go to the emergency room. But part of the education of getting in this program is that this isn't an emergency system, right? And they know what to do when readings are high, or when they're low, or when they're abnormal in any way, right? And so that's a really important piece, I think, feeling comfortable from my perspective. But also, we really had a good partnership as well, with Lightbeam, who would help us make sure that we were monitoring blood pressure, just sending out these texts when we were open, right? So on holidays and things like that, they'd come to us and say, well, what days are you going to be open? And let's not send out the texts this day. Let's not send them on Christmas Day, so you're not getting all these alerts on Christmas Day, right? When you're going to be, not at your desk and not able to actually, manage these. And so we would just shut them down for those days. And they also really helped us even, for the expected time downtime, but also for the unexpected. We're here on the Gulf Coast. You've probably seen in the news some of the hurricanes and weather that we get. We were down for over a week in the summer with a Hurricane Beryl, and so partnered with Lightbeam just to make sure we weren't sending texts during that time, right, when we're not able to be at our desk and monitor those patients. And so that was always really helpful, is that partnership in making sure that we were sending these out when we had people that would be able to monitor these values. And so, yeah, like we'd mentioned, we had really awesome drops in blood pressure, the 21.13 drop in systolic and 6.46 drop in diastolic for patients that have been over 160, and an 8.73 drop in systolic patients, and 3.41 drop in systolic for patients that have been over 140. So it's just been really great to see that the success we were hoping for and the better outcomes we were hoping for did actually transpire with the use of this program. And over that, I mean, we really had overall success with our hypertension initiative. Overall, Care Signal and remote blood pressure monitoring is a big piece of it, but we, like I said, implemented other strategies to improve hypertension, our blood pressure control for patients with hypertension. We had ended 2023 at 53% of our patients with hypertension who were controlled, and we set a goal to get to 60% control. That was where we really wanted to go. And like we said, we had a multifaceted approach, with the remote blood pressure monitoring being a piece of that approach. And we were so excited to not only reach our goal of 60%, but we actually ended the year with 63% of our patients with hypertension that had achieved blood pressure control, which was just really, really awesome to see, basically a 10% jump through these initiatives. And I do know that the remote blood pressure monitoring was a big piece of that. So moving on to provider experience. So, as I touched on in the beginning, I think really investing in staff and making sure that they understand this program and they understand the benefits to patients and the benefits to their flow in their day as well is really, really important piece of it. Obviously blood pressure logs can be great and we still use those for patients and that can be beneficial, but those are subject to patients filling them out and remembering to bring them in and writing it down accurately and whatnot. And so, just being able to bring up the care signal screen with the logged blood pressures is, when needed, can be really, really helpful. Also knowing that it doesn't add anything to providers' days, right? We're not asking them to go in every single patient and check for this. We're not asking to go in every single day and check for this. We're saying when you have a patient that is in this program, you have access to this data that you can use in your patient visit, and we'll alert you if we feel like there's a reason that you need to go in and look at it, right? And so I think that puts providers in a place where this is something that enhances my care. This is something that I can use during this visit, but it's not like this extra system that I have to go figure out and transfer and do these, all these things that can make my day go haywire. And so I think it's been accepted and really embraced by our clinical teams, including providers, as something that can help them take better care of their patients, something that can help them patients take better care of themselves. And so I think that's just a really important piece, is taking that time to have your staff understand what we're doing, why we're doing it, and the benefits, and include them in the conversation, right? We've had many debriefs with the team, like, how is this going? How do you think we can get more patients? What do you think? And including them in the conversation versus, here's this program that we need you to implement, right? So for me, that was crucial. And then we're always just so excited to see how our patients feel about the work that we're doing. And we were able to get really good feedback through this program from patients, that the messages improved our communication with us. They felt more connected to us, with 7.72% agreeing that that our communication improved their communication with us. And that we also want to make sure we were sending them the right number of messages, right? Like, we all get so much on our phones every day. We didn't want them to be like, oh, another one of these texts, delete, stop, discontinue, end. And so we were able, through the data collected through CareSignal to determine what was the right frequency and get that feedback. And it turns out it was sort of right on point, with 8.09% of our patients saying, yeah, this is the right amount of messages that I want to receive from you guys. And then also, just getting more data about the frequency. Was there anything we can improve? And also the literacy of the text. Did they understand what we were saying? Did it make sense? Were they able to respond to it? And again, the data just really reinforced that we were on the right track as far as how much we were sending and the way that we were sending it. And then we got some really good feel-good stuff from patients, that, they really appreciated their involvement in this program. Thanks for taking the time to text me. It helps me keep track of my appointments. I wouldn't change anything. I like that we can care for our health through text for those of us who has a busy schedule. It is great to see that patients see those benefits. We did have here at El Centro a patient who really shared that, they'd had hypertension for a while and they've gotten obviously management of it and care for it and education, but just really sharing that, like, they never really felt like anyone had helped them understand how to manage their blood pressure at home before, and that they really felt cared for by us, and that they were, felt cared for by being a part of this program that we were offering them. And so that always feels great, connections with our patients and having them trust us. Hopefully helps them come back and keeps getting the healthcare that they need. And so it's just always great when we can get that feedback from patients. And there was a whole lot of that along the way. And so, obviously the patients that this works for and that are engaging with this are really getting a lot out of it, both through the data and through the anecdotal, stories that they're telling us about their engagement with this program. So just to sum everything up here, best practices, I think we've spoken to it with our use of our attempted use of the iPhone technology through MyChart, and then moving on to something that was just direct text messaging and calls on patients' phones, but understanding what your patients need, what they want, what will work for them, trying to meet them, where they're at and give them something that will work in their daily lives. And that's why this one really has worked really well for us, supporting our patients and just education from every way we can on how they can manage their own health, how they can manage the blood pressure, how they can understand how different activities in their life impacts their blood pressure and make changes based on that. And then ensuring that we have good buy-in. I think, one of the things I haven't touched on yet, and I will just briefly here, is that we had such strong support from our senior leadership to do this. There's a very strong desire to increase better outcomes for patients with hypertension. And so, knowing that we had their backing in trying this, we didn't know if we'd be successful. We didn't know if this data was going to show all of these drops in blood pressure like it did and high patient satisfaction. But knowing they had the support of our senior leadership team to say, like, this is a thing out there. A lot of people are trying this, and we want our patients to have access to it too. And having our senior leadership support that and say, yeah, let's try this. Let's try this for our patients and see how it goes. And really engaging with that has been really critical, I think, to the success of the program here at El Centro. And then having a plan to graduate patients, as Griselda touched on. We just were so excited to get patients enrolled and engaged. And it took a minute, honestly, about a year, we were like, wait a minute, these patients have been in here for about a year. They're in the habit of taking their blood pressure. We should probably go ahead and graduate them and get new fresh patients in who can benefit from this. And obviously, we want patients to continue taking their blood pressure, but once you've been taking it 2 or 3 days a week for a year, you're probably going to keep doing that. If we recommend, keep doing that, you just don't have to answer these texts, right? And so that's when we move toward, enrolling patients with a 6-month period and then graduating at 6 months to make sure that we're giving them enough time to form habits, to understand the trends, to understand their blood pressure, and then creating opportunities for new patients to come in. And then, like I said, I showed with the data, the impact on our measures has just been awesome to see the data showing that where patients are much more likely to have controlled blood pressure with some of the strategies we've implemented, going from 53% in 2023 to 63% in 2024 has been just incredibly exciting. These measures are tough. They're tough to move the needle on. It can be complex measures that it can, it's not simple to get patients to change behavior or change, health outcomes, but it's been really exciting to see a 10% increase there. And then for us, just seeing some of the changes that we have been able to make, I think it really does justify the use of this program. And so when we're looking at the budget and saying, is this something that we need? I think being able to have all of this data and patient anecdote as well really adds to the case for yes, this actually really enhances our clinical care. And this is something that our patients are engaging in and something we want to continue to do and invest in here at El Centro. And with that, I believe that wraps up our content portion, and I can turn it over to Q&A. Thank you all.
All right. Well, we do have some time for some Q&A. We have a couple minutes here anyway. If you have a question for any of our speakers or just in general, go ahead and drop it in now using your control module. We're going to get to as many of those as we can during the time allotted. If we don't get to yours, though, don't worry. Someone will reach out to make sure we answer your question. Okay. First question is this. One of the issues preventing adoption of RPM is the amount of touches and staff that are involved in RPM is not commensurate with reimbursement. Can you talk about reimbursement and the amount of time and staff involved?
Laura, do you want to take that, or I can take that as well? Yeah. So only 2 to 3% of touches actually results in an alert for a care manager, right? So they have a very predictable and manageable workload. The messages are automated and take the guesswork out of which patients need help, allowing the staff to really focus on helping the patients who need it the most. And this shows that reimbursement, when the reimbursement is focused on technology alone, results in a break even in the best case scenario. It's not a revenue driver, but it is an investment in succeeding in value-based care, which pays off in terms of improved quality measures, resulting eventually in higher reimbursement. Laura, anything to add to that?
No, I think that's exactly right. I think number one, finding a way to implement this with your existing staffing is really, really important. This is another side task that that support staff can manage along with the other things that they're doing, right? Like checking sterilization, checking the temperatures and on the vaccines, checking telephone encounters, checking the RPM database, right? And so we not having a specific physician necessarily investing in that to be able to do this has been really helpful. It's it's just something else that can be done in downtime. And then, like you said, it's not like something we're specifically billing for. But when we have these increases in our measures, I mean, these are things that can impact our quality incentive reimbursements. They can affect value-based care reimbursements. They can, make us look more attractive when it comes to certain grants and other opportunities. And so I think it's having sort of that big picture approach to this is going to move the needle, and what doors will that open for our organization?
Thanks, Laura.
You're welcome.
All right, next question. What is your opinion on advocating RPM for the very elderly population, like 85 plus, and those who are not so tech savvy?
Yeah, I can take first crack at that as well. So it's hard to believe, but a lot of seniors don't actually have cell phones or want to use cell phones or devices. In fact, the case study, the previous experience that Griselda and Laura talked about exactly pointed to that. So I think the notion of using, even landlines, right, is something that, deviceless RPM lends itself to. And we literally have thousands of accountable care organization, Medicare patients on the technology. And there are actually amazing stories, gut-wrenching stories of patients waiting by their landline for the call because they know that someone cares and they value that call even though they know it's automated and it's through IVR, right, or voice response, automated voice response. So I think this lends itself well, especially to patients who are technology challenged and do not have cell phones, as they pointed out, don't have the latest iPhones or have Bluetooth integration and things like that. And that's precisely probably the reason why the deviceless RPM technology has been recognized as best in class for the last 3 years. Laura and Griselda, do you concur with that? Anything to add?
Yeah, I'd love to hear Griselda's thoughts. And one thing I just wanted to add is I think, often with healthcare, it can take a village, right? And so even if our patient maybe, doesn't want to engage with or is not able to engage with the texting technology, do they have maybe a child that's like, oh, I can help partner with that. We'll add those in for you. And that's fine. That's great if that works for that patient. There's other ways that you can do it with support. And Griselda, I'm sure you've seen some of that. I don't know if you'd like to touch on some of the support we've seen with patients that don't necessarily want to actively engage with the technology themselves.
Right, yeah. So like Andy said, we did have some patients that preferred the phone calls because they can answer it on the keypad or they're more comfortable using the phone calls. But then we also had patients that are older and live, with their children or their grandchildren. And oftentimes they would come with them to their appointments. So I would just show the daughter, like, this is how simple the text is going to be. This is all you have to send. And that worked out great for the older population.
Great. Next question, and we are running out of time, but what is your engagement rate?
I think over 38% of patients were engaged for nearly 2 years, right? Or almost 23 months, right? If I got that right.
Right. And it was actually a surprise. I feel like that's much higher than I thought. I thought people would, that they would not engage with it quite as much. And I was really surprised by that number. People really embraced this technology and wanting to know what their values were, wanting to share them with us and track them. So we're really pleased by that.
I think
Okay.
those are all the questions we have time for, right? So, hey, I'd like to, on behalf of Lightbeam Health, really take the opportunity to thank Laura and Griselda. What a fascinating story. I learned so much. I'm relatively new to the company, so this is an amazing, story, the outcomes, and the fact that it's having such an impact on real people in those vulnerable communities. It's just such an amazing human interest story, and the fact that technology like this is moving the needle for those patients and for El Corazon, El Centro del Corazon is just an amazing story. So thank you again, Garrett. Thank you for the partnership. And please, send us your questions and any, if you want to learn more about how you can perhaps embrace this, do let us know and we'll be happy to respond. Thank you very much for your time and your attention today and have a great day.
Thank you, everybody. Thank you also, Laura and Griselda and Andy. As we close out here, wanted to briefly encourage you guys to all head over to VBC Exhibit Hall to check out the Lightbeam virtual exhibit booth. And Laura, can I get you to go to the next slide here? There we go. There's a picture of it here. There's a direct link on your slides that will be there, and you can visit there and really read up on Lightbeam and what they're doing in the space. Really educate yourself on their solutions, and of course, reach out through there. And then as Andy said, if you would like to reach out to the Lightbeam team, feel free to do that there, or you can reach out to me. I'm happy to facilitate an introduction for you. And thank you again all for spending your day with us, and we will see you on the next one. Have a great afternoon.
Thank you.
Bye-bye.
Thanks, everyone.